What's up, guys? Welcome back to The Right Side. Today, I want to talk about healthcare. Healthcare is a hotly contested topic not only in contemporary politics, but historical politics. The question of how much governmental interference we want in the healthcare system surely puts many in a defensive stance. Many people rely on government programs that involve healthcare. Medicaid and Medicare are programs with incredible prevalence in today's healthcare system. How much should the federal government be involved in healthcare? How much could we cut Medicare and Medicaid and still have an effective system? Could we abolish Medicare and Medicaid and still have a functioning healthcare system? Before we get into the video, subscribe and ring the bell if you want to support and help the channel grow. And as always, if you enjoyed this video, hit the like button. With that out of the way, let's get into it. Knowing how we got here in the first place is important to understand when we talk about how we tackle these contemporary healthcare issues. So first, I want to delve into the history of both of these programs, looking at how they were originally constructed at their respective times and how they evolved into the behemoth public programs we know them today. LBJ signed Medicare and Medicaid into law with the passing of the Social Security Amendments in 1965. Medicare was created as a health insurance program for the elderly, whereas Medicaid was created as a health care insurance program for the poor. Both programs were funded by taxes on the earnings of employees, matched by contributions by their employers, and by the third year of the program, 12 million beneficiaries enrolled. In 1966, Medicare officially began providing health care coverage to individuals aged 65 and older. The program consisted of hospital insurance, covering inpatient hospital stays and limited post-hospitalization care, and medical insurance, covering physician services and outpatient care. Meanwhile, Medicaid also began, covering a broad range of health services, including hospitalization, physician services, and long-term care for eligible low-income individuals and families. In the 80s and 90s, additional expansions occurred, including coverage for hospice care, mammography screenings, and preventive services. The introduction of Medicare Part C, Medicare Advantage, in 1997 allowed beneficiaries to choose private health plans as an alternative to traditional Medicare. Amendments allowed states to expand Medicaid coverage to pregnant women and children and families with incomes above the federal poverty level. The Children's Health Insurance Program, or CHIP, was established in 1997 to provide health coverage to children and families with incomes too high for Medicaid, but still unable to afford private insurance. The Medicare Prescription Drug Improvement and Modernization Act of 2003 established Medicare Part D, which provides prescription drug coverage to private insurance plans. In 2010, the Affordable Care Act, also known as Obamacare, further expanded Medicare, closing the donut hole in Part D coverage, offered preventative services without cost sharing, and implemented various cost-saving measures. The ACA included provisions to expand Medicaid eligibility, making more low-income adults eligible for coverage. However, a 2012 Supreme Court decision made Medicaid expansion optional for states, leading to varying levels of expansion across the country. In 2014, states that expanded Medicaid saw increased coverage for low-income adults and closed historical coverage gaps. Okay, so with all that out of the way, it's time for a philosophical basis for such governmental interference. As with all public programs, you are never guaranteed that your tax dollars are going to be spent effectively, only that they are being spent at rates that might exceed their budgets. For historical context, it's important to note the era of politics under which these programs were created. LBJ passed these healthcare programs within a larger agenda called the Great Society Program. Alongside Medicare and Medicaid, welfare programs were established that would decimate the social landscape of the United States for years to come. LBJ stuck his foot in the public health care door so that Bernie Sanders and company could open it up completely. Barack Obama, one of the most socialist and progressive presidents in the past 50 years, gave Americans a taste of socialized medicine with Obamacare as an individual mandate, not to mention the promise of keeping your doctor. The absolute failure of Obamacare is pivotal to understanding how governmental interference does not make things magically better. As many as 214,000 doctors opted out of participating in Obamacare exchange plans. Premiums increased by about 60% in the first 4 years. Studies showed that instead of going to a doctor's office for care, people continued using emergency rooms for non-emergencies. When the government attempts to step in and save the day for the unknowing and ignorant citizens, they only further muddy the waters. You cannot create a blanket program and expect everything to be okay. One size does not fit all in a country of 50 very different states. This is why most healthcare policies rightly lay at the state level. One of the major problems, however, is the rule regarding insurance companies offering services across state lines. I am, of course, referring to regulations that restrict health insurance companies from selling policies within the state in which they are licensed. This means that health insurance companies can't sell its policies across state lines unless they go through the process of becoming licensed in that state as well. A great analogy for this absurd scenario compares health insurance providers to teachers in a classroom. Imagine each U.S. state as an individual classroom with its own set of rules and preferences. Here, each classroom represents a unique healthcare market, and its students are consumers seeking health insurance coverage. Currently, health insurance companies are like teachers that can only offer their services within their assigned classroom or state. Each classroom state has its own curriculum, regulations, classroom rules, consumer protection laws, and preferred teaching methods, healthcare systems. Now, the idea of health insurance companies crossing state lines is akin to a teacher from one classroom being allowed to offer their teaching services to students in another classroom. Consider that I am an ardent supporter of school choice in private schools. Forcing health insurance providers, who are private entities, from even attempting to navigate the dubious regulatory burden is nothing short of government overreach into private markets. This restriction of competition is a result of lobbying by large insurance providers to create interstate monopolies in their markets. One of the arguments against opening state lines is that it would be a race to the bottom. But if Montana has an open regulatory environment compared to, say, Illinois or whatever, let the policies flow. This would greatly expand access, improve quality, and slash prices. Another aspect of healthcare that really drives me crazy is the idea of price caps for prescription drugs or treatments. People commonly advocate for price caps on insulin, for example, but I don't think people really think through these things. It's a disastrous policy as price caps lead to shortages, disincentivizing competition from ever entering the field due to lack of profitability. The high cost of treatments and drugs is a function of the FDA and their frivolous regulation and agency power. President Donald Trump signed the Right to Try legislation on May 30th, 2018. The law aims to expand access to experimental treatments for patients with life-threatening conditions who have exhausted other options. The legislation allows eligible patients to request access to investigational drugs that have completed phase 1 but have not been fully approved by the FDA. The goal is to allow seriously ill patients to try experimental treatments outside of the traditional clinical trial pathway. The FDA is the cause of many prescription drugs and treatment bureaucracy and regulatory capture, which prevents patients from seeking and obtaining the best possible drug or treatment. The FDA was created in 1906 by Theodore Roosevelt, but it wasn't until his cousin FDR that the monstrous policies of regulatory capture gave the FDA unparalleled power and authority over healthcare innovation. Interestingly, the first power the FDA was given was to require manufacturers to prove the safety of their drug. Luckily, these companies were already considering these factors, which led to a minimal increase in the price of medicines since the regulatory burden wasn't that stifling. The next step, however, is what led to the slow and painful death of prescription drug and treatment innovations in the United States. The Federal Food, Drug, and Cosmetic Act of 1938 not only reinforced the safety standard for new drugs, but it mandated that manufacturers demonstrate the efficacy of their products. This set a new higher bar for the approval of pharmaceuticals, no doubt causing regulatory capture, limiting competition, and racking up the cost due to extensive costs of trial phases. The sheer influence that the FDA has over these manufacturers causes them to be highly cautious and deterred from exercising Trump's right to try legislation. All of this is to say blatantly, the power, authority, and influence of the FDA needs to be reeled in severely and radically. We need to reduce the heavy regulatory burden of these manufacturers to lower the costs of daily drugs Americans need through innovation and competition. All the different levels of government that put their hands in the process of delivering accessible and quality healthcare at a market price drive these hospitals and clinics to expend exorbitant amounts of capital to stay compliant with regulations while still innovating to stay ahead of the competition. The answer is to minimize governmental interference in the healthcare process and make it as streamlined as possible. It is putting costly and burdensome agencies like the FDA and various health agencies in check to stifle their unconstitutional regulatory authority that damages the average American through expensive prescription drugs and monopolizes health insurance providers. While catastrophic health insurance can be a marginal benefit, the incredible regulatory and administrative burden that going to a checkup with your family physician and paying through insurance creates is staggering. Most of the country doesn't realize that their doctor would charge less if their patients offered to pay cash themselves. This occurs because of the insurer and doctor-hospital relationship. Getting an x-ray costs $10,000 because the hospital knows it's not charging you, they're charging your insurance provider. No one would disagree that no one spends your money as carefully as you do. If you were given a shopping cart from a welfare program, you would be much more reckless of a spender with that money than if it was a paycheck that you earned. The hospital knows you don't have money, but they know that your health insurer does. The hospital overcharges your insurer until they come to a happy medium that seems outrageous, while you only need to pay a fraction of the amount because your insurer picks up the rest of the bill. This process is helpful in catastrophic health events like accidents or whatever, but less valuable in regular checkups. The next issue I want to tackle is whether healthcare is a human right. The term human right is a convenient tool for the left in terms of creating a euphemism to allow the government to expand its powers and overreach. There's a difference between a human right that allows an individual action like protesting or owning a gun and a human right that requires the labor of another individual. If healthcare is a human right, then anyone can access a doctor at any time. Doctors are like mechanics. If the shop is full, they can't help you now. However, if healthcare is a right, a doctor must take you as a patient, or else they would be denying your right to care. If I force a mechanic to accept my car, they must ration the resources to care for each car. Any waiting period before caring for my car would be a denial of my rights. It is the same if healthcare is a human right. I am not afforded my rights if I can't have immediate access to health services. Regarding free speech, I can stand on public property and protest all I want. Regarding guns, I can patronize a gun store and obtain a gun all I want. The next step would be a single-payer system, putting the government in charge of negotiating with doctors. We already covered earlier the number of doctors who opted out of participating in Obamacare programs. Now imagine if they had no choice. Given how easily the bill for private health insurance providers can get for mundane health services, the only worst negotiating agent is the government. The same system that bends the knee to military companies, which causes an explosion in defense spending, would oversee the keeping healthcare affordable. Government is inefficient, it's bureaucratic, and it's expensive. Suppose you think that our healthcare system is already an administrative swamp and is bloated and inefficient. What would happen if the mother of all regulations stepped in for private insurers? To get a little bit more radical, how should state or local governments step in for their citizens? Should we force health insurers to cover pre-existing conditions? Is there any way to achieve a fair and equitable health insurance environment? The answer here is to establish what we want the healthcare industry to be. What should be the goal of drug manufacturers and companies in charge of research and development? My vision for an ideal healthcare environment is an opened up marketplace where patients can seek treatments independently without being bogged down in the jungle of bureaucratic regulations and red tape that is our current healthcare system. So what about pre-existing condition coverage? True equity and fairness in health insurance where private insurers will be to charge those with pre-existing conditions a higher fee because of their past health choices. Smokers should be charged more than non-smokers for the bodily risks they have accrued over their lives, pausing from their choices. Conservatives believe in the reality of choices and consequences. In life, there are trade-offs, and people make different decisions based on their values at the time. This is the freedom of a liberal society, which allows for destructive behaviors. What conservatives advocate is punishment or rewards for your past behavior. These punishments and rewards create a social incentive system. We ought not to subsidize poor choices, but this is what happens when we force these companies to cover pre-existing conditions. Healthcare is the first step in the left's mission to treat everyone the same regardless of circumstance, which sounds harsh. Now, what are the implications of requiring coverage of pre-existing conditions? Many argue that not covering patients with pre-existing conditions is discriminatory and thus unjust. With the exception of genetic conditions, this is all nonsense. This is absurd for the principal argument and the societal implications. First, the principal argument is inconsistent at best and incoherent at worst. Imagine you have a car with 175,000 miles on it. If you bought a car with 175,000 miles on it, insurance rates for that car will not be the same for a car that has 25,000 miles. The age of car carries different risks. The same goes for bad drivers. To the insurer, you are a huge liability and are treated as such. The difference between rates for bad drivers and premiums for the obese is that car insurers eventually lower your rates if you practice and demonstrate safe driving. This does not exist for those who are overweight. No one would argue, all else being equal, that obese individuals are at the same risk for health events than the average individual. Those who have type 2 diabetes have higher risk. This is the reality. Women who have had abortions face difficulties with fertility later in life and carry higher risk. These risks for the insurers are accounted for in their premiums, and rightly so. Secondly, the societal implications of non-discriminatory coverage for patients with pre-existing conditions is misguided at best and unjust at worst. Why should non-smokers have to pay more for the treatments and medications for smokers? Why should virgins have to pay more for fertility treatment for women with abortions? Why should athletes pay more for insulin prescriptions for obese individuals? People, by their free liberty to make decisions, make their bed and should be forced to lie in it. These incentives for a healthy lifestyle reinforce the natural state of human nature. Fit, virgin, or non-smoking patients carry far fewer health risks than not, and their rates should reflect that. In the end, the debate over healthcare is not merely about policy. It is about the philosophical and practical implications of government involvement in our lives. The expansion of programs like Medicare and Medicaid, along with the regulatory power of agencies like the FDA, has deeply entrenched the government in our healthcare system. However, this involvement is not translated into better care or lower cost. Instead, it has created a complex, burdensome system that stifles innovation, limits competition, and fails to account for the individual responsibility that is essential in a free society. Healthcare should not be treated as a guaranteed right that imposes obligations on others, but rather as a service that operates within a competitive, market-driven environment. Only by reducing government interference and allowing the free market to function can we ever hope to achieve a healthcare system that is both effective and fair. It is time to confront the hard truths and move towards a system that rewards personal responsibility and innovation rather than the one that continues to expand government control at the expense of individual liberty. I hope you guys enjoyed the video. If you did, I'd appreciate you hitting the like button. If you'd like to support and help the channel grow, please subscribe and ring the bell to stay updated with all my uploads. Finally, whether you agree or disagree, leave your thoughts in the comment section below. I love to engage you guys in respectful and thoughtful discussions. With that said, I'll see you guys next video. See ya.